Good morning. We're about to begin. If you're able to hear me clearly, raise your hand. All right, that's good enough. Lower the hands, please. All right, thank you. All right, this morning, we officially move into the core concepts of the EMT training. We'll be starting with medical terminology. Some of the participants in the course have medical backgrounds, so they are already familiar with medical terminology. But for the persons with no medical background, it's important that you have an understanding or you're familiar with medical terminology before you start to cover anatomy and physiology. So we're starting with chapter 5. It's going to be on the exam on Monday. So the exam on Monday will consist of chapter 5 and chapter 6. Let's get into it. Introduction. EMTs need a working knowledge of medical terminology. With a working knowledge of medical terminology, the EMTs will be able to understand key terms, break down acronyms, understand the use of symbols and abbreviations. With knowledge of medical terminology, the meaning of an unknown word can be determined. So we can use it to break down medical terms and understand what these terms mean, and it will promote good communication with persons within the medical fraternity. Now, let's break down the anatomy of a medical term. So medical terms are made of distinct parts that perform specific functions. Changing or deleting any part can change the function or meaning of a word. The components that comprise medical terms include the word root, the prefix, which is at the beginning of the word, the suffix, which is at the end, and the combining vowel, which is often used to combine two word root, or it is present for easy pronunciation of the word. How the parts of a term are combined determines its meaning. Accurate spelling is essential. For example, phasia with S-I-A means speaking. Phasia with G-I-A at the end means eating or swallowing. And if we add a prefix, this, which means difficulty or painful, it changes the meaning. So dysphagia with SIA means difficulty speaking. Dysphagia with GIA means difficulty eating or swallowing. How the parts of a term are combined determine its meaning. This is very important. Now, apart from that, a strong knowledge of anatomy and physiology is important, and we must understand the context that the word is being used in or used for. Word roots. main parts or stem of a word. It conveys the essential meaning and frequently indicates a body part. If we add a prefix, which is at the beginning, or a suffix, which is at the end, it changes the meaning of the term. Example, cardiopulmonary breaks down into cardio. Cardio is the word root meaning heart. Pulmon is a word root meaning lungs. During CPR, you introduce air into the lungs and circulate blood by compressing the heart. Now, prefixes. They appear at the beginning of a word, usually describe location or intensity. Also found in general language, example, autopilot, submarine, tricycle. Not all medical terms have prefixes. Prefixes give the word root its specific meaning. And we have some example. For the word root pinea, pinea is breathing. So pinea is breathing. And if we add various prefixes at the beginning of pinea, it can change the meaning of the word. So if we add a, which is without, it becomes apnea. Apnea. Apnea means without breathing or no breathing. That's what the term apnea means. If we add the prefix Brady, Brady means slow. If we add that to pinea, it becomes bradypnea. Bradypnea means slow breathing. If we add the prefix tachy, tachy means rapid or fast. If we add tachy to pinea, it becomes tachypnea. Tachypnea is rapid breathing. So you can see from the example, by adding 3 different prefixes, we have changed the concept of the word root, pinea. By learning commonly used prefixes, you can figure out the meaning of unfamiliar terms. Right. Now, suffixes appear at the end of words, usually indicate a procedure, condition, disease, part of speech. Commonly used suffix itis. So the suffix is at the end. The term itis means inflammation. If you see the term itis and you're thinking about inflammation, inflammation is associated with swelling, leakage of fluid, and a rise in temperature. Paired with arthro, which is the word root for joint, it becomes arthritis, which is inflammation of the joints. Now let's look at combining vowels. Combining vowels connect word root to suffix or other word root. Most cases, it's an O. It may also be an I or E. Used when joining a suffix that begins with a consonant to make the word easier to pronounce, or when there is 2 word root present. And an example of that would be gastroenterology. Gastro is stomach, entero is intestine, logy, study of. So gastroenterology is a study of the stomach and intestines. Combining form, a combining vowel shown with the word root. Some common combining forms that you need to be familiar with as an EMT is cardio, which is heart, gastro, which is stomach, hepato, which is the liver, arthro, joint, osteo, it's the bone, and pulmono, lungs. All right, now word building rules. Summary of the rules. The prefix is at the beginning of a term. The suffix is at the end of a term. Use a combining vowel when the suffix begins with a consonant to ease pronunciation. A term has more than one, or a term has more than one word root. Now let's look at plural endings. We will apply these rules. Sometimes you will add S, example, 1 lung, 2 lungs. Words ending in A, we change to AE. So you have 1 vertebra, more than 1 vertebrae. Words ending with IS, we change to ES. 1 diagnosis, many diagnoses. Words ending with EX or IX change to ICES. So there is 1 apex, multiple APCs. Words ending with ON or UM change to A, example of that, 1 ganglion, change that to ganglia, more than 1. 1 ovum, more than 1 ova. Words ending with US, we change to I. 1 bronchus, more than 1 bronchi. Special word parts. Prefixes which are at the beginning can also indicate numbers, colors, positions, and directions. Let's go through some examples. Numbers. Some prefixes indicate that a term involves a number or 2 or more parts or sides. Examples: uni, 1, dipple, double, null, 0 or none, primi, 1, multi, more than 1, bi, 2. Colors. So let's look at some example of colors. Cyano, cyanosis. So cyano is blue. Leuco, leukocytes, white blood cells. So leuco is white. Erythro, erythrocytes. Erythro is red. Red blood cells, erythrocytes. Cero, cero is orange or yellow. Melano is black. For positions and directional terms, prefixes can describe a position, direction, or location. Examples: ab, AB, means to move towards. Ab means to move towards. No, that's not correct. Ab means to move away from. Abduct, move away from. So AB is to move away from. Add is to move towards. DE means to move downward. Circum, circular. Peri, around. Trans means to pass through. Epi is above. Supra means it's close to the surface or top. Common direction, movement, and position terms. Directional terms needed to discuss where an injury is located and how pain radiates in the body. So we need to be familiar with directional terms that when we're handing over to the doctor or nurses, we can be specific. So we cannot say that the patient got a cut on him hand on the side there, next to the side there. It has to be specific. So that's where the use of directional terms come into play. And we can't say the patient, say the pain and move all over. We need to be specific. Now, some directional terms include right and left. Now, when we talk about right and left, well, hold on a sec. Let me just draw a picture. Let me create a little picture right here. I don't like this color. Let's use black. All right, so let me create a picture just to the side. Use a square for the body. Use a circle for the head. Let me move that a bit. Put that here. And let's use some straight lines for the arm. Hold on. Straight lines for the arms. And straight lines for the legs. All right, so you should be seeing my diagram, hopefully, because I just went through a lot of trouble. Now let's draw a line straight down the center. All right. All right, now some directional terms include right and left. Now, when we think about right and left, it is not your right and left. It is the patient's right and left. So just keep that concept in mind. For superior, superior would be closer to the head. So superior is closer to the head. Inferior is closer to the legs or lower extremity region. Lateral. Now, if you're looking at my diagram, you should be seeing a line drawn directly in the center. That line is referred to as the midline or mid-sagittal line. The mid-sagittal line divides the body into two equal halves, or midline divides the body into two equal halves. If a structure, so let me use my pencil now. If a structure is close, let me, what's going on here? Pencil, color. If a structure, man, is moving towards the midline, if the structure is moving towards or closer to the midline, it is referred to as medial. So if we look at the forearm, the pinky side of the forearm would be medial. If a structure is moving away or its position is away from the midline, it is referred to as lateral. So the lateral side of the forearm would be the side where we have the thumb. So medial means it's close to the midline or mid-sagittal line. Lateral means it's further away from the midline. Or quick and fast, medial, the inner portion of the limb, lateral, the outer portion. Now, proximal and distal is a bit tricky. So let me draw another diagram that represents the long bone. So let me draw it down the bottom, straight line. So I'm going to draw a diagram that represents long bone. All right, so that's my long bone. You should be able to see it. The terms proximal and distal is specifically applied to the long bones in the body. Now, every long bone, I probably need to change the direction of it. Let me change the direction. Come on. All right. Cannot change the direction right now. Every long bone in the body has a distal end and a proximal end. So every long bone in the body has a distal end, a proximal end, and a shaft. The shaft of the long bone is the mid portion. The distal end of the long bone is the portion that is further away from the trunk of the body. Now, when we use the term trunk, it is the chest, the abdomen, and the pelvis without the head, arms, and legs. So let me repeat that. When we use the term trunk, it is the chest, the abdomen, and the pelvis without the head, arms, and legs attached. If the portion of the long bone is close to the trunk of the body, it is referred to as proximal. So if it's close to the trunk of the body, it is referred to as proximal. If the portion of the long bone is further away, so if it's further away from the trunk of the body, that is referred to as the distal end of the long bone. So when you're going through your practicals, I'm not going to tell you exactly where the fracture is. I'm going to give you a presentation. The patient slipped, tried to break his fall, came down on the arms, and he's complaining of pain just above the wrist. So just above the wrist. And there is some deformity there. So if the patient fell and tried to break his fall, and he's now having pain just above the wrist, Which portion of the forearm is that? Is it distal or proximal? Can anybody answer that question?
Distal, sir.
Good. So that would be distal. If I said, go ahead, Mr. Duhaney.
All right, good morning, everyone. In explaining the distal so forth, that the distal is basically the appendicular system of the skeletal system, and the proximal is the axial aspect of it, excluding the head, right?
No, I don't want you to take that approach
Hello.
because that's not the right approach to grasp the concept. So we're not in the musculoskeletal system as yet. All we're looking at is position and directional terms. It has nothing to do with appendicular or axial skeleton. We don't reach that stage yet, right? So when you see the term proximal or distal, it is applied to a long bone, whether it's the forearm, the upper arm, the thigh, or the legs. It's applied to long bones in the body. Every long bone in the body has a distal end and a proximal end. The proximal end is going to be close to the trunk. The distal end will be further away from the trunk. So don't complicate things yet. We need to creep, right? So we need to start creeping first, then we need to start walking, then we need to start running. We're gonna do it in stages. So get the fundamental concepts first. Now, if I said to you that the patient has deformity to his upper arm, just above the elbow. So the deformity is to the upper arm, just above the elbow. Would that be distal or proximal? Can anybody answer that question? Go ahead, Mr. Graham. Go ahead, Mr. Graham. Not hearing you. So type. Mr. Johnson, go ahead.
Yes, good morning, sir. It would be distal.
Distal would be correct. So the bone that is injured is the humerus. So the distal end of the humerus would be closer to the elbow. The proximal end would be closer to the shoulder, and the shaft would be in the middle. Good. I think we got the concept. So that's usually the most difficult positional or directional term for students to grasp. Ensure that you grasp it. Let's move on. All right, now superficial means close to the surface of the skin, and deep means it's below the soft tissue or deep inside the soft tissue. Ventral is the same as anterior or front portion. The term anterior is used more often than ventral. Dorsal is posterior or back portion. The term posterior is used more often. Palmar, that's the palm of the hand, and plantar is the bottom of the foot. Apex is the point of a structure, and it doesn't necessarily mean that it has to be pointing upward, right? Because the apex of the heart is actually in an inferior position, and the apex of the lungs is in a superior position. So it doesn't necessarily mean that it's always in an upright position, but apex is the point of a structure. So superior and inferior: superior nearer to the head, inferior nearer to the feet. Terms describe the relationship of one structure to another. Example: the knee is superior to the foot and inferior to the pelvis. Lateral and medial: lateral, outer, body parts that lie farther from the midline or mid-sagittal line. In general, lateral means side. Medial, inner, body parts that lie closer to the midline. Example: a 5 centimeter laceration on the medial aspect of the thigh means towards the inside. Proximal and distal describe the relationship of any two structures on an extremity. Proximal, closer to the trunk; distal, farther from the trunk, nearer to the free end of the extremity. The elbow is distal to the shoulder and proximal to the wrist and hand. Superficial and deep. Superficial means closer to or on the skin. Deep means farther inside the body tissue, away from the skin. Example: superficial burn is a sunburn, so that means only the top layer of the skin is affected. Deep laceration: cut deeper into the tissues as with a knife, so it goes through the top layer and the bottom layer, can also go down to the bone. It means it's deep inside the soft tissue. Ventral and dorsal. Ventral refers to the belly side of the body, anterior surface of the body. Dorsal refers to the spinal side of the body, posterior surface of the body. Example: dorsal fin of a dolphin. More commonly used terms are anterior, front surface of the body; posterior, back surface of the body. And we won't learn the terms unless we start to use the terms. So as you go through the terms, you need to start getting the habit of using these terms. Palmar and plantar. Palmar surface, front region of the hand, the palm. Plantar surface, bottom of the foot. Apex or apices. Remember, apex is one, apices more than one. Tips of a structure. The apex of the heart is the bottom inferior portion of the ventricles, and that can be felt, well, not felt, listened to at the 5th intercostal space, that's just below the nipple. Movement terms. Flexion. So flexion is the bending of a joint. Let me see if I can get some diagrams here. So flexion would look something like this. So that's flexion, right? The extremities at a right angle. Extension is straightening of the joint. So an extension is straightening of the joint. Now let me do ab and adduction. Need my square again. No, rectangle. Let me do a rectangle here. All right. With a circle or ellipse at the top. straight lines. Right, so let's look at adduction first. Now, adduction means the limb is moving towards the body. There is no flexion or extension. It's just movement of that limb towards the body. So you're trying to position the patient's limb towards the body to log roll the patient, and the patient complains of pain. That's pain on adduction. So it's motion towards the midline. You're moving the hand or extremity, upper extremity, across the chest to secure a strap, and the patient start to complain of pain. That would be adduction. So that's movement of the limb towards the midline. So let me draw the line that indicates that. So it's moving in this direction towards the midline. Now, adduction is the opposite. So adduction is the opposite. What am I? Yeah. Adduction is what we're seeing now. ADD, towards the body. Abduction is the opposite. So this is what abduction would look like. So it's moving away from the midline. It's moving away. Abduct, when you abduct, when somebody gets abducted, they're taken away. So the limb is moving away from the midline. So you might be moving the arms away from the body to check the mid-axillary area or the side of the body, and the patient starts to complain of pain when you do that. So that's pain on ab with the AB, abduction. Now, other directional terms. Bilateral means both sides of the midline. Example, the eyes, ears, hands, feet. Structures inside the body also appear on both sides of the midline. Example, lungs and kidneys. Unilateral, only on one side of the body. Example, unilateral chest expansion. So that means only one side of the chest is moving, which can be observed if the patient has a collapsed lung. Other directional terms, the abdominal cavity is divided into 4 equal quadrants for the EMT level. As if you go higher in medicine, then it will be divided into 9 portions or sections, but at the EMT level, it's just 4. And you have the right upper quadrant, the left upper quadrant, right lower quadrant, left lower quadrant. As the course progresses over time, you will have to know the solid and hollow organs that are located in each section as we go forward. Other directional terms. Learn these concepts, right? So it's important to learn these concepts to describe the location of any injury or assessment findings. So medical personnel will know where to look and what to expect. Now, anatomic positions. So you have what is referred to as the normal anatomic position. And with a normal anatomic position, you're picturing the patient. So you picture the patient standing, head in a neutral position, the palms facing forward, and the thumb pointing outward. That's what we refer to as normal anatomic positions. But outside of that, there are other positions that the patient can be found in. So your patient can be found prone or supine. If the patient is found prone, it means that the patient is lying face down or on the belly side. Supine means the patient is lying on their back, so the face is pointing upwards. Fowler position means the patient is in a sitting position, and it can be high Fowler's or semi-Fowler's. If it's a high Fowler's position, all that means is that the patient is in a 90-degree angle. So Fowler's position would be that. And this is where the degree, the angle of 90-degree would be right here. So I'm using the red line to indicate the 90-degree angle. So that's a high Fowler's. You also have what is referred to as a semi-Fowler's. And what the semi-Fowler's is, it's a 45-degree angle. Right? So that would look something like this. At semi-Fowler's. And let me use the red to indicate the angle. This would be the angle. So I'm using the red line to show the angle, the 45-degree angle. So you have the high Fowler's and the semi-Fowler's. Now, these positions are necessary when you have a patient that is having trouble breathing, or they might have fluid retention in the lungs. We tend to want to travel with these patients in an upright position, because if they're lying flat, the fluid starts to spread further inside the lungs, the membrane. And that can interfere with their ability to breathe. And we'll go deeper into that as the course progresses. Go ahead, Mr. Morant.
Sir, about a patient that is lying face down, like the front of the body is down on the ground. What is that position is called?
If you're lying face down or on the belly surface, that's a prone position.
Okay, sir. Thank you.
All right. All right, now breaking terms apart. Use the meaning of parts to decipher the term. Define in this order. The suffix. Remember, your suffix is going to be at the end. Prefix at the beginning. Word root, that's the main stem, and usually convey the meaning of the word, the primary meaning. All right, nephropathy. Nephropathy. So pathy means disease. O is the combining form. Neph meaning kidney. Nephropathy, disease of the kidney. Dysuria. So ia means condition of. This means difficult, painful, or abnormal. Ur means urine. Dysuria, painful urination. Hemiparesis. Sorry, why am I saying hemiparesis? Hyperemesis. Hyperemesis. The prefix hyper means excessive. Emesis means vomiting. Hyperemesis is excessive vomiting. Analgesic. Ik suffix meaning pertaining to and prefix meaning without or absence of. Alges, word root meaning pain. Analgesic pertaining to no pain. All right, now abbreviations, acronyms, and symbols. It's a shorthand used for communication, and it's developed for speed. I'm not a big advocate for abbreviations and acronyms or symbols. They may be necessary. However, it is very important that when you're using symbols, acronyms, and abbreviations, it is based on the accepted abbreviations and acronyms. So you have to use one that is universally known, because if you start to use shorthand and it's something that is not universally known, it can be misinterpreted. And so if I write SOB, the patient was found presenting with SOB in my report. I know that as a medical person, I know that as a medic, that means shortness of breath. But for a person with no medical background, that can be misinterpreted if it is not universally accepted. So it can be misinterpreted. And you don't want to use abbreviations or acronyms in your report that can be open to interpretation. We only want factual stuff in the reports, because if a lawyer gets a hold of your report and you're using stuff that are open to abbreviation, they're going to tie you up in court. So be careful of that. But there are agencies that will use specific abbreviations or acronyms. That's fine, as long as it's universally accepted. Now, abbreviations take the place of words to shorten notes, documentation. Use only accepted ones to avoid confusion or errors. Be familiar with the abbreviations in your service area. Symbols sometimes used as a shortcut. Use only accepted symbols to avoid confusion or errors. And that would be medical terminology. All right, so let's look at some of these questions. Review. Question 1, know the answer, raise your hand. Go ahead, Mr. Jones. Mr. Jones, go ahead quickly.
The word root.
Okay. That would be C as in cat. Next question. Question number 2. Mr. Doheny, have your hand up. Go ahead.
B, conditions.
B as in boy. Is that a B as in boy? All right, not hearing. A would be the answer. So prefixes are used to indicate colors, numbers, position, or direction. Suffixes will indicate a procedure, condition, disease, or part of speech. Word roots will indicate specific body parts. All right, Miss Kerr, you had your hand up. Next question is yours. The plural form of the word bronchus is?
Bronchi.
That would be D as in dog. Give me letters. D as in dog. That's what you're saying, right?
Yes, sir.
Okay. Next question is Mr. Barnes. I believe you had your hand up. Next question is yours. That's Tristan Barnes. Go ahead. The statement, the lungs are superior to the bladder, indicates that the lungs are closer to the
feet, sir.
Is that A as in apple?
A.
Okay. Okay. Feel free to type in the chat if you know the answer as well. Number 5, the movement of the arm toward the midline is referred to as, this one is tricky, so let's see if you can get this one. I see Graham, I see Washington, so someone said C. Let's do Haney. Go ahead, Mr. Graham. I see C, seen a lot of
That's
C's.
C, sir.
Okay, C as in cat.
Adduction, yes, sir.
All right. That would be correct. Number 6, a body part that lies closer to the midline when compared to another is considered to be. So a body part that lies close to the midline. I'm seeing A as in apple. Anybody else agree with that? Seeing A's. All right. I'm seeing consistency. All right. Majority has said A. A would be correct. A would be correct. All right. Number 7. This is used to identify a body part that is on the belly side or anterior surface of the body. Correct. So I'm seeing these, as in dog. Yes, Mr. Johnson, go ahead. Mr. Joel Johnson,
sir.
yeah. D as in dog?
Yes, sir.
All right, noted. Noted. That would be correct. All right. You place a patient in the semifolus position for transport. This means the patient is in what position? How is this patient sitting? Okay. All right. All right, I'm seeing a lot of C's. C as in cat. That's what I'm seeing. That would be correct. All right. A laceration located on the plantar surface is on the plantar surface. Okay. I'm seeing A as in apple. Go ahead, Mr. Barnes. You have your hand up.
A, sir. A.
Okay. Let's find out. That's correct. And the final question is, when using abbreviations, acronyms, or symbols, and EMT should. I'm seeing B's and I'm seeing D's. I'm seeing A's. Interesting. So when using abbreviations, EMTs should be familiar with those used in their agency. I would agree with that. When using only, B says use only those that are medically accepted. I would agree with that as well. Use them to shorten documentation. That's a main purpose. I would agree with that as well. So I would say the answer is D as in dog. All of the above. All right. And that would be the end of medical terminology. Now, remember, this chapter is going to be on the exam on Monday. So you need to start studying this chapter. All right, we're gonna take, what time is it? Gonna take a 15, I don't want it to be